Hello everyone, I'm Dr. Tamrat Sultan, co-founder and executive lead of Hulucares. I'm a medical doctor, and during my medical internship at Juma Medical Center, I met a brave woman named Sarah. She was a mother of two who worked hard to support her two kids by selling goods in her village. Even though she started feeling unwell a while ago, she delayed seeking treatment due to the fear of high medical expenses. And by the time she visited our hospital, she was diagnosed with end-stage kidney disease, and it was too late. Her two kids were forced to drop out of school to support their mother on the medical expenses, and witnessing this devastating, heartbreaking experience made me realize this is not just about Sarah, but a sign of a bigger problem in our healthcare system. Our healthcare system is in a crisis. More than 66% of the medical expenses are paid out of pocket, and this results in 50% of treatment delayed. And sadly, we have the lowest insurance penetration, less than 1%. These are not just a number, but these are real figures that shows real people that are suffering from a devastating impact of medical expense hurdles. So that's why Hulucares comes in. As a medical doctor, especially when I was practicing at Juma Medical Center, I was in a daily basis, we were encounter patients that was suffering from medical illnesses that can be treated easily, but it becomes to some extent worse due to they delayed their treatment due to the fear of high medical expense. And that's not just one time or two time story, but that is the reality we are facing on Ethiopian public healthcare system, and people are suffering from delayed medical sicknesses due to the fear of high medical expenses, and this results in even more expensive treatment on these people. And this hardship doesn't only stop in one individual, but it extends to the whole family. Most of the time they even sold all their assets, including their cows, their farms, and they try to get treatment for their beloved one, and that really impacts the whole family. More of like it's like I was witnessing the problem, and also I was also seeing the solutions at the same time, because we were also having this CBHI, community-based health insurance, and it's one of the best health insurance scheme in Africa. Its penetration is really good. Around 80% of our population have community-based health insurance, but community-based health insurance only works in public healthcare network. And this public healthcare network, even though there are the professionals, the specialists, most of the time we will not get the laboratory reagents, medications, or any instrument to do the whole treatment our clients really need. And due to that, we mostly refer patients to private healthcare networks, including pharmacies, diagnostic centers, and other private healthcare institutes. So that really impacts our clients, because we are talking about clients that are underserved communities and that doesn't have more of like a financial flexibility to do extra budget for their medical expenses beyond the CBHI. So that made me realize that if we can integrate the private healthcare network in this insurance scheme, we can come up with a solution. So that's where the idea comes, and not only about including the private healthcare network, but it's more of even way beyond, because as you know, in Ethiopia and in Africa, more than 86% of our population use informal risk pooling mechanisms like Iddir, which is like a community support system where members come together and contribute some amount of money in a regular basis for specific risks. So what we basically do is we are integrating that long-standing traditional asset, and we are currently transforming them into a community-based health insurance scheme. Their members can get access in the private healthcare network. Prior to GRV, we have one partnership with one of prominent insurance companies, and also we have around 26 healthcare network under Hulucares. and we have one healthcare financing product. And after GRV, through the support of GRV, currently we have more than 400 medical centers under Hulucares, and we are currently finalizing 4 healthcare financing products, which are not only microinsurance, but they are microsaving, microcredit, and microinsurance. So it even opened our eyes, and it made us realize to solve this big healthcare gap. Health insurance or medical insurance is not the only options, but we need to go and do the customer discovery ourselves, and through GRV we did that customer discovery, and currently we are more of like healthcare financing company where anyone can start their medical saving and get medical credit or loans for their medical treatment, and also they will have this buy-table microinsurance products for their healthcare needs. So GRV really transformed our journey from only focusing on medical insurance now to become more of healthcare financial solutions that provide microcredit, microsaving, and micro insurance for our community for their healthcare needs. So GRVSummit was to some extent a unique experience because we were going through this long journey, and we were almost pitching for a big crowd and a big stage. It was a big stage, and I was feeling more of a mixed, it was a more of a mixed feeling, and I was a little bit emotional, and to some extent I was out of words. So that was what's really happened. It's been really rewarding, especially and also a big responsibility, because as a GRV legacy builder finalist, we need to build this legacy startup, and we need to prove that as Ethiopian founders that we are capable of building and solving our own nation's problems, and that's what really wake us every day. And we are trying to solve the biggest problem of the continent, which is the healthcare financing, the out-of-pocket medical expense. So being a GRV finalist means a big responsibility, and showing that we as Ethiopian founders that we are capable of creating a legendary legacy ventures. So yes, currently through the support of GRV, we already built Lanchi, which is woman and family only microsaving, microcredit, and microinsurance product, and also Tena Sabi, which is a general purpose medical microsaving, microcredit, and microinsurance, and also Telemedin, which is buy-table microinsurance product. So our vision currently in a short period of span, we are planning to launch these products in partnership with our financial partners and make those products available for our communities and solving their medical hurdles, especially the financial hurdles that comes with medical issues. So, yeah, so basically the biggest challenge is not only about funding. So the biggest challenge comes with running a business, and running a business needs experience. And as a GRV finalist, most of us have a huge different types of experience from different background. So we have like edtech startups, and also these agri-tech startups, and also health tech startups, and most of the entrepreneurs in the community are from different background and different sectors, and that gives us a big advantage where we get feedback and more of like their insights on from a different point of view. So most of the time I may see things from medical or healthcare background, but most of court members will see from different perspective, and that will add a lot of input to the solutions that we are bringing to the table. So currently these two platforms, especially Lanchi and Tena Sabi, is would be a nationwide platform for healthcare financing, which anyone can start saving for their healthcare need and get access to diverse healthcare services, and they can also get micro loan for their medical issues and buyable medical insurances. So anyone across the globe, any Ethiopian diaspora can send money to their families through Tena Sabi and Lanchi, and it will be launching really soon. So anyone can support us by sending for their families a medical saving account for their families. We are really grateful about the support that we get from GRV and Ethiopian Diaspora Trust Fund and all Ethiopian diasporas that involved on this big legacy mission. So we are really grateful and thank you.